seeing the incredible far-reaching effects of the surgery was very eye-opening for me. And then on my second mastectomy patient, because as you mentioned, I'm a massage therapist, the second mastectomy patient was saying almost exactly the same thing as my first one, which is, I just don't know how to heal from this surgery. I don't know the resources to look for, and I feel completely overwhelmed with what to do. So, I started to adapt the techniques that I've been using to the new clientele that I was working with, and I learned a lot. I always say my patients are my best teachers, better than any course that I've taken, because they are the ones who are, it's like straight from the horse's mouth. They're the ones really going through the experience, and that's where I learned from the best. And I also picked up tips from them about, what worked at home and what didn't work at home, and what they would have wanted to know, and what they, wish they had known beforehand, that somebody had, if they had told them, they would have done this differently, but they just didn't know. And so those kind of tips I was passing on to other patients. And then when COVID hit, it interrupted my practice, which actually turned out to be a great blessing, because then all that information that I was getting from my patients and passing on, one-on-one, word of mouth, I instead put into a video training program for home care support, so that patients know what they can do at home, what exercises they can do to both prepare and recover from surgery, and then also how to maintain their health and wellness over the long term using self massage and stretching and strengthening, positive affirmations, mirror work, and also some practical things like how to arrange your kitchen before you have your surgery, so that when you're after your surgery, you don't have to be reaching up for heavy things. And I'm now also passing on to other massage therapists in the training programs that we're doing, so that massage therapists know how to support patients from pre-surgery to after surgery. And they also just understand what's happening underneath the skin. A lot of people, they just don't know the extent of the surgeries. Like, they are major. And, I look at the wow factors in the post-program assessments that people have. And often one of the things that comes up is the volume of surgeries, because we go over 18 different types of breast surgery in the teaching programs that we do. And then also the extensiveness of the surgeries and what the bodies actually go through while they're on the table. And then how impactful the recovery is, taking the biopsychosocial model, where a person is their body, their thoughts, they're integrated into a wider society, and they have a variety of different dynamics that are going on. How do you work with somebody in a very human centric way, where you're meeting them person to person, also, as a professional to a patient, and working with a very sensitive area? So we're covering all these things and in the courses. And so, it's been a great evolution from when I first started to now. And this work, I think, is very groundbreaking. It's still very progressive and very new in the world. And, my goal is to normalize all of this, so that it becomes as normal to go for breast care as it is to go for neck and back care, or ankle care, and or hair or nails or something like that. And all the people who are currently suffering, they just don't have to, because they know what to do in order to be able to get beyond it. And the therapists also feel confident, because so many people are really intimidated by A, working with cancer patients, and B, working with breasts. And that lack of confidence, I think, really inhibits their ability to treat effectively.